The night director Conrad Blaine decided to make Cassidy Farrow a punchline. He did it in front of 32 people, 2 security cameras, and a journalism intern who had been quietly filming everything through a glass partition for the past 6 hours. He did not know about the intern. That was his first mistake, it was not his last. Before I tell you what happened inside Mercy Ridge Medical Center on the night of the Caldwell Street explosion, let me say this. Some people carry their entire life inside a badge that says almost nothing. Tonight's story is about a woman who wore hers face down for nearly a year, and what happened the night someone forced her to turn it over. If you believe that quiet people are usually quiet for reasons the loud ones never bother to understand, hit like, subscribe, and drop a comment telling me where you're listening from. Now, let the story begin. Cassidy Farrow showed up for the night shift at 6:47 p.m. the way she always did, 13 minutes early, no makeup. Hair pulled back in a knot tight enough that it looked like it had been tied by someone who did not plan on losing anything that night. Her scrubs were that particular shade of blue that hospitals order in bulk, the kind of blue that made people feel like the person wearing it was slightly less important than the person in the white coat. She was 38 years old, 5'6", a face that gave away nothing and held everything. Her badge said RN, below that her name, below that Mercy Ridge Medical Center, Caldwell, Indiana. That was the whole biography as far as the hospital was concerned. The ER that night was the usual kind of loud. A broken wrist in Bay 2, a chest infection in the waiting room still pretending it was heartburn. 3 flu cases and a man who had been stung by a wasp and wanted to be told he was not dying. He was not dying. Cassidy moved through all of it the way she moved through everything. Efficiently, quietly, without announcement. Director Conrad Blaine arrived at 7:15 with his sleeves rolled to the elbow and the look of a man who believed showing up after hours was the same thing as caring. He was 51, broad-shouldered, the kind of administrator who had stopped listening to nurses sometime around 2009 and had been coasting on that decision ever since. He ran 3 departments, reported to a board, and spoke at conferences about patient-centered culture in a voice that made the phrase sound like it cost him something. He walked past Cassidy without looking at her. That was normal. What was not normal was the call that came in at 7:31. The Caldwell Street building, a 6-story mixed-use structure on the east end of town, had partially collapsed after a gas line explosion. Fire crews were on scene, paramedics were inbound. The count coming over the radio was rough and getting worse. At least 9 people pulled from debris, 6 of them critical. ETA to Mercy 11 minutes. The charge desk lit up. Dr. Wesley Hatch, the senior ear attending, was already pulling on gloves. Surgical was being paged, respiratory, lab, radiology, all hands. The ear shifted into the specific kind of controlled chaos that good hospitals know how to run. Cassidy was already at the supply cart checking airway equipment when Director Blaine stopped behind her. She had filed 4 staffing complaints in the past 6 months. 4 memos about inadequate trauma bay coverage, about night shift nursing ratios that left ERs running thin, about equipment checks that got signed off without anyone actually checking. She had submitted them through proper channels. She had seed the department head. She had waited. Nothing had changed. 1 memo came back with a handwritten note. Our protocols meet state standards. Focus on your lane. She had not stopped filing. That, apparently, was the problem. Nurse Farrow. Blaine's voice was the kind of pleasant that functions as a warning. You've had a lot of opinions lately about how this department should run. Cassidy did not turn around. She was counting laryngoscope blades. Tonight, Blaine said, louder now, making sure the charge desk could hear him. You'll have your chance to demonstrate that expertise. She turned then, slowly. He was smiling the way people smile when they believe the smile is enough to make what they're doing, not be what it is. 6 incoming patients, he said. Critical. I'm assigning them to you. He looked around the room. At the residents, the nurses, the desk clerks who had gone very still. Dr. Hatch has the overflow from Bay 2. Everyone else is needed upstairs for the elective overflow. Nurse Farrow can handle the trauma bay. Dr. Hatch looked up from his chart. Conrad, you can't. I'm not asking, Wesley. I'm delegating. Blaine straightened his cuffs. She has opinions about our protocols. Let's see what she can do with 6 patients in full authority. He said full authority the way someone says all yours when handing over a mess they have no intention of cleaning up. A resident named Cho whispered something to the nurse beside her. Nobody laughed, but a few people looked away, which was worse. Cassidy looked at Blaine for a long moment. Her expression did not change. I'll need Gina, she said. 1 nurse. Then I need Gina. Blaine opened his hands in a gesture of mock generosity. Fine. He stepped back. He did not leave. He positioned himself near the glass wall of the charge desk where he could watch, and where the camera mounted above the desk could capture him watching. Later, the people who reviewed that footage would note that he appeared satisfied. The kind of satisfied that requires an audience. Cassidy turned to Gina, a 12-year AR nurse with forearms like a longshoreman and the driest sense of humor in the department. "With me," Cassidy said. "Obviously," said Gina. The ambulance bay doors opened at 7:44. The first stretcher carried a man named Russell, 53 years old, a construction site supervisor who had been on the 4th floor when the east wall gave way. Both legs pinned for 22 minutes before extrication. The paramedic called his pressure in the doorway, 74/40 and dropping. His right femur was fractured in at least 2 places. What the paramedic did not say, but Cassidy saw the moment she cut away the tourniquet to reassess, was that the bleeding was not where anyone had been treating it. "Proximal," she said. Gina looked at her. "You sure?" "Check the medial compartment." Gina's hands went where Cassidy told them. Her face changed. "How did you?" "Keep pressure there. Don't move." Cassidy had already moved to the second stretcher. The second patient was a teenage boy, 17. His name was Tyler, and he had been sheltering under a stairwell that had partially held. His chest had not. The paramedic reported bilateral breath sounds, but Cassidy put her stethoscope on him for 3 seconds and straightened up. Tension pneumo, right side. The resident who had followed her in despite Blaine's instruction, a young woman named Kim who had decided her conscience outranked her fear of consequences, shook her head. "His SAT is 91. It won't be in 4 minutes, get a 14 gauge now." Kim hesitated. Cassidy looked at her once. "You're going to do the right thing," Cassidy said. "Not a question. I'll talk you through it." Kim got the needle. Behind the glass, Blaine's smile had not moved, but something behind it had shifted. The third patient was Faye, 31, 7 months pregnant. She had been in the building visiting a friend when the explosion hit. The impact threw her down half a flight of stairs. She was conscious, but her blood pressure was wrong in a way that could mean many things, and one of them was the worst thing. When Faye's monitor alarmed, Cassidy went to her first, took her hand and said, "I see you, I'm not leaving." Faye said, "My baby." Cassidy said, "I know, that's why I'm here." She sent Marco, the ER tech, to find a portable ultrasound that still had battery. She sent Kim, after the chest decompression, to call the on-call OB and tell them to come down regardless of what Blaine had said about staffing. She told Gina to stay with Russell and not let anyone move his leg until she came back. Then she ran to Bay 4. Bay 4 held a woman named Dana, 26 years old. She had inhaled smoke for an indeterminate amount of time, and her oxygen saturation was currently 83, and falling in a way that suggested the problem was farther down than anyone had yet reached. Cassidy did not have respiratory. Respiratory was locked on the 7th floor, with a cardiac case that had come in 90 minutes ago. She did the assessment in under 40 seconds. She adjusted the oxygen delivery. She repositioned Dana's head and torso at an angle that was not in the standard ER nursing protocols, the specific tilt, the way she placed one hand on Dana's sternum and listened before she looked. Dana's SAT climbed to 89, then 91. Marco came back with the ultrasound and 19% battery. Cassidy used it for 80 seconds, found what she needed in Faye's abdomen, and said, "Baby's heartbeat is present. Mother is the priority. Don't let that change." Dr. Hatch appeared at the edge of the bay. He had left Bay 2 anyway. Whatever Blaine had told him, watching through the glass had been enough. "Cassidy, what do you need?" "Blood for Russell, warm, he's losing heat, and call vascular." "Vascular is in surgery." "Then call them out of surgery and explain the situation." Hatch looked at her, really looked at her, for the first time in however many months they had worked together. "Okay," he said. Bay 5 held a child. Her name was Ivy. She was 9 years old. She had been in the building with her mother, who was now in Bay 6 with a head injury that had knocked her unconscious. Ivy was awake, which should have been reassuring. But Ivy was awake and not making any noise, and Cassidy knew the difference between a quiet child who was scared and a quiet child who was disappearing. She had learned it in a place that did not have hospitals. She sat on the edge of the gurney. She put 2 fingers on Ivy's wrist, watched the monitor, then looked directly into the girl's eyes. "Ivy, my name is Cassidy. You're going to help me do one thing." The girl blinked. "Breathe in when I do." Cassidy breathed in slowly, deliberately, in a rhythm she had used before in places where the air was full of things that were not oxygen. Ivy watched her and slowly matched it. The monitor steadied by a thread. Marco wiped his face with his sleeve. He had been in emergency medicine for 8 years. He had never seen anyone bring a pediatric patient back like that with nothing but breath and eye contact. Cassidy was already at Bay 6. The 6th patient was Harold, 67, a retired school principal who had been on the ground floor when everything came down. His legs were mottled and swollen. His urine output, when Marco checked it, was almost nothing. Cassidy looked at the labs on the board and went still for half a second. Crush syndrome, she said quietly to Hatch when he appeared beside her. He read the numbers. We caught it early enough? If we move now, she laid out the protocol. Fluid management, lab intervals, urine monitoring, the specific electrolyte pattern to watch for over the next 4 hours. She said it fast and clean, no wasted words, the kind of report that assumes the person listening is capable of keeping up. Hatch kept up. Harold reached for her arm, his hand was shaking. Are you going to be honest with me? I'm old enough that I'd rather know. Cassidy covered his hand with hers. You came in at the right time, we caught this. I'm going to take care of you like you're the only patient in this building. He let out a long breath, thank you. Don't thank me yet. I need you to do exactly what I tell you. Yes, ma'am. Behind the glass, someone on the desk staff had started crying. Not from fear, from something that did not have a clean name. Blaine was no longer smiling. At 8:17 p.m., 33 minutes after the ambulances arrived, Cassidy stood at the central board and ran through the list. Russell's bleeding was controlled. Tyler's collapsed lung had been decompressed and his SAT was holding at 94. Faye's blood pressure was stabilizing and the OB had finally arrived. Dana was breathing with maintained saturation. Ivy's pressure had crept upward and the girl had fallen asleep with her hand around Cassidy's finger before Cassidy gently moved it. Harold's fluid protocol was running. All 6 patients were alive. Dr. Hatch stood beside her. He was quiet for a moment. Cassidy, he said, where did you learn to perform a field tourniquet assessment for proximal vascular injury? She did not answer right away. The lung decompression, that technique. He stopped, started again. The positioning you used for Dana's airway. I looked it up once in a paper from the Journal of Special Operations Medicine. That's a combat positioning method. Cassidy set the marker down. Blaine stepped forward from the doorway. He had been waiting for this. She could see it on him, the posture of a man who has been holding something for a long time and has finally decided to use it. Yes, he said. Let's talk about that. Let's talk about what qualifications Nurse Farrow actually has, and whether any of what she just did falls within her licensed scope of practice. Hatch turned on him slowly. 6 patients just came in from a mass casualty event, and they're all still breathing. Maybe save the credentials conversation for a morning when no one is bleeding. She performed interventions not authorized under RN licensure in the state of Indiana, Blaine said. That is a liability issue. That is a board issue. It needs to be addressed tonight. The room had gone quiet in the specific way that rooms go quiet when everyone in them has decided to stop pretending. Nurses who had drifted toward the bays, residents who had disobeyed the staffing order and come anyway. Marco, Gina, Kim, all of them still. Cassidy was looking at the board. She spoke without turning around. Review everything I did tonight, she said. I want you to. Review the tourniquet reassessment. Review the decompression. Review the positioning for inhalation injury. Review the pediatric stabilization. Review the crush syndrome protocol I put Harold on before his kidneys had time to fail. She turned. And then tell me which one of those patients you'd like me to undo. Blaine's jaw moved, no sound came out. Because that, Cassidy said, is what it would take to make tonight a liability. A new voice spoke from the ambulance bay entrance. She's right. 2 people had come through the doors. Neither of them was in scrubs. The first was a woman in a federal jacket with a sealed identification folder in her hand. The second was a man in dress uniform, Army, with silver leaves on his collar, and the particular bearing of someone who had learned stillness somewhere that punished movement. Blaine turned. This is a restricted. The woman in the federal jacket opened her identification. Special Agent Monica Draper, Department of Health and Human Services, Office of Inspector General. She looked at Blaine with the specific expression of someone who has been in this same room with this same kind of man many times before. We've been monitoring Mercy Ridge for 4 months. The air shifted. 4 months, Blaine repeated. Following 3 patient deaths, elderly patients, survivable presentations that deteriorated after delayed triage attributable to repeated staffing decisions made by this department's administration. Someone in the room made a sound, not a word, just a sound. I was not informed of any investigation, Blaine said. No, Agent Draper said, you weren't. The Army officer had not moved from the doorway. His eyes had found Cassidy the moment he walked in, and they had not left her. Chief Farrow, he said. The room did not gasp, it simply stopped. Hatch said very quietly, Chief? Gina covered her mouth with one hand. Marco sat down on a stool. Blaine turned to look at Cassidy. Something in his face had gone uncertain for the first time all night. The officer walked forward and stopped 10 feet from her. Lieutenant Colonel Dwight Camara, he said, for the room's benefit, formerly with 3rd Special Forces Group. He looked at Cassidy, Staff Sergeant Cassidy Farrow, 18 Delta, 4 deployments, 2 commendation medals, 1 Silver Star classified Operation 2019. Blaine laughed once. It was the wrong kind of laugh, the kind a person produces when the mind rejects the sentence it just received. She is a registered nurse, he said. Yes, said Kamara. She is also a former Special Forces medical sergeant with 9 years of combat medical experience, including mass casualty triage in active hostile environments. He looked at Blaine the way people look at something that has been in the way for a very long time. She did not perform anything tonight that she was not trained to perform under conditions significantly worse than this. The board behind Cassidy showed 6 names, 6 monitors still singing. Blaine straightened, adjusted his cuffs. Whatever her background, she acted outside authorized scope. She made unilateral decisions that… You left 6 critical patients with 1 nurse as a deliberate act of humiliation, Hatch said. His voice had no heat in it. That was worse. In front of cameras, in front of staff, you chose this. I delegated. You abandoned them. Hatch turned away from him, and she saved them anyway. Agent Draper stepped forward. Director Blaine, your conduct tonight is now part of a state and federal review that includes the 3 previous patient deaths, which our preliminary investigation suggests were linked to administrative staffing decisions and falsified incident reports. She opened the folder. We'll also be reviewing the complaint memos filed by Nurse Farrow over the past 6 months, which align with every safety failure documented in our investigation. Blaine looked at Cassidy. You filed those complaints. Yes. You had no authority. 3 people are dead, Cassidy said. I had every obligation. What Blaine did not know, what none of them knew yet, was that the journalism intern in the waiting room had been filming a documentary on the American emergency medical system. She had been at Mercy Ridge for 6 hours. Her camera, positioned against the waiting room glass, had captured the ambulance bay, the charge desk, and Director Blaine's face in full light when he made the joke. When she saw federal agents entering the building, she turned over the footage immediately. It was clear, the audio was clean. Blaine's expression during the 33 minutes he stood behind the glass was all there. The precise moment the first monitor alarmed and he did not move. The moment Kim performed the decompression and he watched without calling for help. The moment Ivy's pressure dropped and he looked at his watch. All of it, every second. It became part of the federal record within 2 hours. Blaine's attorneys arrived before midnight. The board chairman arrived shortly after. Cassidy gave her statement at 1:14 a.m. in the same scrubs she had been wearing since 6:47 p.m. Agent Draper asked her one question at the end. Why didn't you tell the hospital about your military background when you were hired? Cassidy was quiet for a moment. Because I wanted to be a nurse, she said, not a story. 6 weeks later, the federal report named the failures plainly. Fraudulent incident reports. Retaliatory administrative action against nursing staff who filed safety complaints. Delayed triage linked to deliberate understaffing on nights when oversight was reduced. 2 board members resigned. Blaine was terminated and faced state licensing review pending the federal findings. The board chairman retained counsel. All 6 patients from the night of the Caldwell Street explosion survived. Russell walked out of Mercy Ridge 41 days later with a cane and his physical therapist's card tucked in his shirt pocket. Tyler went home with his parents and a follow-up appointment he promised, twice, that he would actually attend. Faye delivered at 39 weeks, a boy, healthy, brought into the world by the same OB who had come down to the ER that night after Cassidy called. Dana completed a pulmonary rehabilitation program. Harold hosted Thanksgiving dinner for 32 people and emailed the hospital to say so. Ivy drew Cassidy a picture of a nurse with a stethoscope and a cape. Cassidy kept it on the shelf behind the charge desk. Marco framed it. Hatch asked Cassidy to lead the trauma orientation for the incoming resident class. She said she would need 1 hour per session. Kim said, apparently that's enough. 3 months later, the hospital put 4 rules above the charge desk. No patient waits unseen. No staff member is penalized for raising safety concerns. No administrator overrides clinical triage. A nurse is enough. That last one had not been Hatch's original wording. He had written no one is ever just a nurse. Cassidy had objected, not to the idea but to the word just. It framed the whole thing as a defense, she said, and a defense still concedes the attack. He changed it. On the morning Conrad Blaine's administrative sanctions became public, Cassidy arrived at Mercy Ridge at 6:47 a.m. 13 minutes early. No makeup, hair in a knot, badge on straight. She walked through the ambulance bay, past the charge desk, past the framed drawing and the 4 rules in the shelf where Sergeant Buttons sat watching everything. That was what Marco had named the stuffed bear someone had left in the break room after Ivy's discharge. No one had asked Cassidy's permission. She had not minded. She picked up the marker and looked at the board. What do we have? Gina read the incoming report. 1 chest pain, 2 traumas from a pre-dawn accident, 1 possible stroke. Cassidy nodded. Bay 1 gets the stroke. Bays 2 and 3 get the traumas. Chest pain gets fast track unless vitals say otherwise. Everyone moved. No joke, no hesitation, no one waiting for a director to give permission to care. That was the shift when Mercy Ridge stopped being the hospital it had been, and began, slowly, imperfectly, to become the one it was supposed to be. And Cassidy Farrow, who had once carried 640 square miles of Afghan mountain on the inside of her chest and still showed up quiet, still showed up early, still showed up, clipped her badge straight, picked up a chart, and got to work.